Live with Dara this week is for you. I'm talking about the vagina, the vag, the pum pum, the punani, whatever you want to call it. This week on Live with Dara, that is what we are talking about. Are you satisfied with the look and feel of your vagina? When was the last time you had a good orgasm? Yeah. This week on Live with Dara, this Saturday, September 11 at 8 p.m., we will have OBGYN Dr. Daryl Daley. He'll be on to tell you how you can, get back your tightness, the oku-bit, how you can beautify the vagina, make it pretty. Additionally, through one shot, the O shot, he will tell you how you can be lubricated, that's wet and aroused, and have some explosive orgasms. Yeah, that's what we're talking about. Share the live. Hi, welcome to Live with Dara. On this Saturday, September 11, 2021, I'm so happy that you're here. Share the live. Yeah, tonight should be really interesting. I'm happy that you came because I'm sure you'll learn a thing or two. And here's what, ladies, only will learn something. Even if you don't have the oku-bit and the pretty and the etc, you'll learn a thing or two. Gentlemen, your partner, you will learn something as well. And who to tell, as I was saying earlier, maybe you can gift your partner, one of them, procedures there. I mean, hey, I'm here. Be willing to try anything. There's nothing wrong with enhancing what's there, So, share the live. Share the live. Welcome to Live with Dara. I not get it. I was trying to get it on my tablet so I can see the comments better. But it not work with the tab. How you doing? Hi, Dr. Daley. You see Dr. Daley early now. I'm trying to ensure that I have as many persons on before I start because, listen, you don't want to miss it. You don't want to miss this live. You will learn so much tonight. You will learn so much. I was surprised when I did my poll and I asked ladies if they knew what their vagina looked like. And a lot of them said, no, I couldn't believe it. How can it? In the live, somebody described it as her purse. And they said, how can you have your purse and, inspect your purse to ensure, say, it have no hole? Or to ensure that everything is tight and right and pretty. How can you? And then, there's another thing about gray hair. And gray hair make you not looking. Hello? That's why we have the shaver and we have wax and we have other things you can use and get rid of that. That's not an issue. Listen, that's one of your greatest assets, ladies. So you must ensure that you look at it and you know what's going on with it. So, share the live. Let me get Dr. Daley on. CC baby, I see you're present. Well, go on. Alright. I'm not getting this on my tablet, so I will go without. So, here's where I go. Thank you very much for joining Live with Dara. If it's your first time on the live, Live with Dara aims to link lifestyle issues with products and services. And hey, look at this lifestyle issue. Because we can't believe, say, not talk about them something here. Why unafraid to talk about the vag? And yeah, when I say vag, I mean the vaginal region, alright? Because I know we all call it the vag, but it has different areas. It's actually the vulva, and then you have the vagina. That's the part where, I'll have Dr. Daley explain all of that. Well, we just call it the vag. So yeah, thank you so much for coming Live with Dara. Thank you so much for being here tonight. I really appreciate your presence. I really wanted more persons on before I got, I added Dr. Daley because I have some questions, like some myths. Facts and myths, and I wanted to ask him for him to dispel all of those. And then remember now, then you can ask your questions, and don't be afraid to ask your questions, ladies, because and gentlemen, because believe me, you see, you thinking about it, other person's thinking about it, but they're just afraid to ask it. I don't know why. You must own it and be proud of that organ that you have. All right, so let me just join Dr. Daley now, and then we'll just get it started. All right. Oh, and let's give Dr. Daley a live with Dara. Come, show him some hearts. Dr. Daley, what up? How are
Hi,
you?
how you doing, Dara? I'm
I
fine,
am
thanks.
good. Eh?
I'm fine, thanks. Let's turn up the volume here a little. How you doing?
I
Thank you for
am good.
having me.
I'm happy that you're here. You know, long may I try to get you, right? Because
Yeah.
I want to talk about the oku-bit, and I want to know about the O-shot and all of them something there. You see what I'm
Mhm.
saying? Yes, show him some love while we get the persons on. Show
I,
Dr.
I,
Daley
I- I'm
some
not, I'm
love.
not even in Kingston right now. That's how special they are. I'm actually taking a little break. I'm not even in
Oh,
at home.
gosh.
I had to
Thank
rush up from
you.
dinner. I had to rush up from dinner to be on your show. You know.
Oh, thank you. I hope it's worthwhile for persons, as in persons coming to you. Because you know you have a whole heap of people with a lot of vag issues and they're just afraid to talk about it, right? And I hope
Yeah,
it's
man.
worthwhile for you as well. You know, why they come on, Dr. Daley, why are people afraid to talk about the vagina?
It's taboo. For whatever reason, it shouldn't be. It's just taboo. It's a organ that everybody is shy to talk about, is afraid to talk about, but everybody love it at the same time. It's a misnomer, It's kind of weird, but people are not comfortable talking about it. They want to talk about the breast, they want to talk about the ass and the waist and the liposuction, but once you hear vagina, it's like a bad word. And we're brought up
Uh-huh.
thinking it was a bad word, you know? We're
Yeah,
actually
but we don't
brought up in
understand that.
in my house, vagina wasn't a bad word. My father is a gynecologist, my mother is a pediatrician. It was a word that was introduced to my vocabulary from a very early age, so I embrace it.
As should everybody else. So me not
Yeah,
understand. I did a poll, you see, and I was asking like the ladies if they really know what the vagina look like. Because you know, some of them just go into the bathroom, you get up and you bathe and you put on your clothes and you go work and you come back and you bathe and you not take time to look and inspect and say, yeah, yeah. Me not
No,
understand.
I actually saw a poll online. I don't remember which fraternity it was, but it was pretty high. I think it was like something like 45% of women don't know what their female genital structures look like. They're not familiar with it down there. They're even afraid to look at it for whatever reason.
Yeah. Because well, some of the ladies I spoke with, they said that the gray hair is unattractive. I mean, I said gray hair. You know, can't wax that off, shave that off, dye that up. Well, I don't think dye can work down. That's not what you said, I
hmm
said.
I mean, some women grade down there prematurely. It's a genetic thing as well. Anything can do down there to get rid of it. But
Mm-hmm.
women need to be comfortable with their genitalia. I always encourage women look at it, inspect it, examine it. A lot of things can present itself and it may be something more sinister. So you need to be conscious of, just like any other, you're conscious of your face, you're conscious of your body. Why not be conscious down there? Same thing for men too. Same thing for men. Same thing for men. You know,
But I don't do
Bef-
you, well, I know we're talking about females, but you think the males are as waiting they reserved about talking about them because if them have name feet. I mean, I don't think females have a name for their vagina, but you know, the John and the Dick and the blah blah blah. The males, I mean, I think them love it up and
well,
own
I
it up.
mean, I just think penile health is lacked as well, and men
Uh-huh.
need to be aware that just like their face and their body, you have to pay attention to your penis as well.
Mm-hmm.
Make sure down there is clean. There are penile lotions you can use. Inspect your penis as well. Stuff can be there that you miss. So it's something that you need to be aware of, men and women.
Mm-hmm.
Men and
All
women.
right, so I want to go into some fact because really tonight is for the ladies and the gents who want to ask you questions and of course do further consultation with you after because I know a lot of persons have issues and they really need some help. I mean, you know why them they reach out. So before we go into that though, I want to do the facts and the myths. And you tell me if it is true or false because me hear about some things there, but I want to know if I really say it. All right.
No problem, no problem.
First one. Women who receive regular oral sex are likely to end up with an enlarged labia.
No, false.
We hear that already,
False.
don't?
You hear that all the time. You hear
All
that all the
right.
time. So your labia has nothing to do with the amount of sex you have. You know, that's another thing people always say. What them say? Stretch out and it look like flabby and all of those stuff. But they're actually the genetic predisposition for it, and as you get older and as your hormone levels change and the amount of estrogen and blood flow that goes to the area, it will change as you get older as well. It can change, you know. So
Mm-hmm.
it's not related to sexual intercourse at all.
Okay. So hold on. So as you get older, it'll go drop down.
I mean, it can. Estrogen levels. Remember, estrogen is the main hormone of the females, and that is what gives the youthfulness to the female genital structures. And as they get older, estrogen levels naturally fall. And in some way, when the estrogen levels fall, you know, it can affect the genital region directly and indirectly. The vagina may get smaller. It may not get as lubricated as it should be. It may get drier. The female genital structures will tend to sag. The perineum, that's the distance between the bottom of the vagina and the anus, it starts to get weakened and sags. The labia majora, that's the outer lips, they start to sag as well. All part of the natural aging process, you know.
Granted.
Nothing to be too, and it doesn't happen to everybody. Let me say that
Okay.
again. Some women can have it and some women can't. So
Okay.
it's just something, just like as we get older, we get wrinkles, you know, it's life, eh? It's life.
Listen, because my next question to you is at what age we must start look out for that?
It's life. It doesn't happen to everybody, but they're like I always tell patients that almost everything can be explained
Mm-hmm.
physiologically.
All right. Women's vagina has a natural elasticity. No matter how it stretches, it goes back to normal. Myth or
Uh,
fact?
I'd say that's half half. Again, it boils back down to predispositions, and everybody is different, right? Race has a fact. Your pre-pregnancy weight, your pre-pregnancy health status, your genetic predisposition, all of these things go into play. So the vagina and the pelvis is just a group of muscles that working together or working synchronously to provide tone to the pelvis. So in the pelvis, you have the bladder, you have the vagina, you have the uterus, you have the tubes, you have the ovaries, and you have the rectum. And you have a group of muscles. It's not like an individual muscle, but you have a
Mm-hmm.
group of muscles that are working together to maintain the tone of the pelvis, right? So what can happen with, again, decreasing hormone levels, genetic predisposition, number of childbirth, weight of the child, you actually cause physical trauma to the muscles in the pelvic floor. And sometimes, notice I say sometimes, right? The pelvic floor doesn't go back to its original tone. It can go near normal or back to normal, but sometimes it doesn't go back to its normal tone. And what women can present with is pelvic relaxation. And how that can present mainly is a lack of sexual gratification, because sexual gratification is directly related or directly proportional to friction. So if there's
Mm-hmm.
no tone or if the tone is decreased in the vagina, you're going to have a decrease in sexual gratification on both sides. You know,
Mm-hmm.
so women will tend to complain, but women will come to you and say, boy, doc, since the last baby, I'm not telling like 3 months after, the sex feel different. You know, I used to enjoy sex with my spouse. Right now, I'm not really feeling him. I'm having difficulties climaxing, and there's something obviously wrong. Those are the
Mm-hmm.
patients I find that really do well with whatever I offer them because they have a genuine problem. Yeah, I
Mm-hmm.
understand it's not like boy that me just want to get tight, me just want to get tight. No, the women who actually have a problem, they know
Mm-hmm.
something is wrong with them, right? They and you know, so you offer the options to them. So the answer to that question is half and half. Some women bounce right back, some women half back, three-quarter back, some women don't go back to how it was before. And nothing is wrong with you for that. And that is why there are people like me or doctors like me that are here to help you to reclaim what you once had.
The
If that
oku-bit.
answers the question. Well, oku-bit, whatever you want to call it, you know? Mm.
All right. This one now. If you stoop over hot water with salt, the steam will tighten your vagina. You hear that one?
Rubbish. I'm not a big fan of steaming. Generally, whether it be herbs, whether it be spices, whether it be whatever kind of steam, there's no evidence to support that that's beneficial in tightening the vagina. I can't understand how that works anyway. I try. You remember I said you can normally explain something. I can't explain the physiology for that. You know, but steam going into the vagina, I can't understand that one. I don't think that's gonna work, and I don't recommend it at all. You know, so I don't
Okay.
recommend it at all.
Vaginal tightening gels and sticks work wonder.
Again, there's no evidence to support that. Some patients may say it works. I'm not gonna say it's not gonna work. But again, I am a scientist, so I believe in the evidence, right? We'll have to do a lot of research before we can publish papers and publish standards of care, you know? So I'm not going to recommend using these pelvic ones and these pelvic gels because to my knowledge, these things don't work, you know? But then again, you will have the one or two patients who will swear by it, and that's fine. I'm not here to knock you. You're asking me my opinion. These
Right.
things don't. These things scientifically don't work. But again, it doesn't mean that some people may have some benefit from it. As to how, I can't explain that, you know. But I'm not. I think they don't work. You know,
Okay.
I think they don't work.
Regular orgasms tighten the vaginal wall.
Nah, not true. Not true.
Huh? Cause
I
we
know
just
some people
say,
would like to
yo,
think
we
that.
going out, they gonna do road.
No, that's not true. I mean, when you have what an orgasm is a climax of sexual pleasure, right? So you have different phases of the sexual cycle, and orgasm is the top of it, and then you have resolution when you get back to normal. So what orgasm is a rhythmic contraction of the pelvic floor muscles. Remember, I said it's a group of muscles. So
Right.
everything is working on one. The uterus is contracting, the vagina is contracting, the rectum is contracting, the bladder is contracting, everything is contracting rhythmically for about 20 seconds, right? So after, and it's just a natural contraction, and after the contraction, it goes away. You know, so those type of contractions are not going to strengthen, those involuntary contractions are not going to strengthen the pelvic floor. You know, versus like a Kegel, you
That's
know,
where I'm going
which
to
is
next.
versus like a Kegel, which is voluntary, but involuntary contractions are not going to strengthen the pelvic floor.
Okay, so let's segue into Kegel now. That exercise can strengthen and tighten the vaginal wall.
Okay, to answer that question, so you have different degrees of pelvic relaxation, mild to severe, for all intents and purposes, mild, moderate, severe, right? So Kegel exercises, a lot of women don't know how to do Kegels, and the best way I describe it, or the best way to do it, is to get what we call supervised pelvic floor rehabilitation. So the best person to teach you the Kegels is actually the physiotherapist. They're very good at it, you know, and they can teach you to connect with the pelvic floor muscles really, 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 really well. So women who suffer from mild pelvic floor relaxation, they may have a little bit of what we call stress incontinence when they laugh or cough, and excess abdominal pressure is placed on the bladder because the pelvic floor is weak. So normally the neck of the bladder is in place. And remember I said everything is held in the muscles. So when you have weakness of the pelvic floor, when you laugh or cough and pressure goes on the bladder, normally the bladder neck is supposed to close. But because the pelvic floor is weak and the bladder neck is supposed to be stationary, when you laugh or cough, the bladder neck is moving all over the place. So as a result, the valve can't close properly, so urine will leak out. And
Right.
that is a result of pelvic floor relaxation, which we mentioned earlier. So if you have mild pelvic floor relaxation, right, definitely Kegel exercises can help with this. Definitely if you want to increase the tone of your vagina, there is some evidence to show definitely that for mild relaxation it will work. And definitely Kegels on a whole can help to enhance your whole sexual experience as well. You know, once a woman is in tune with her pelvic floor muscles, the whole act of sexual intercourse can be more enjoyable on both parts. When them say quint it, busy say quint it, you understand?
Alright, so here is one now. Vaginal atrophy. I hope I pronounce it correctly. That is where the lining of the vagina. Atrophy? Okay. Where the
Atrophy, yeah.
Okay, so where the lining of the vagina gets drier and thinner, resulting in itching, burning, and pain during sex. They say that this is caused by regular sex with different partners. Fact or
No.
myth?
So vaginal atrophy, remember we mentioned about this hormone called estrogen, right? So again, estrogen is like the gas or the fuel for the pelvic floor and the vaginal tissues, right? So as women get older, right, and I'm sure you've heard of the terminology menopause. So the definition of menopause is the absence of a menses after 1 year. For 1 year, you don't see a menses. And associated with that, you naturally have decrease in estrogen levels. So what will happen? The vagina is not as rich and rejuvenated and youthful as it normally is. So the vaginal mucosa is normally very thin, right? And these women are more prone to having sexual trauma. So the vagina may bruise when you have intercourse. When you do certain procedures, the vagina may bruise. There's a lot of dryness and sex can be painful. So most of the times when you have vaginal atrophy, it's usually a hormonal problem, a lack of estrogen. But you also have to do your due diligence. I always tell patients, doctors are detectives. Make sure you examine them properly. Make sure there's no evidence of any masses or any cancer in the vagina that could be contributing to that, right? But the main cause of vaginal atrophy is decrease in estrogen levels, or a postmenopausal status, or a perimenopausal status.
Do you find it so that ends my fact or myth?
I actually like this. It's actually a good one. You know, I like the facts, and it's easy.
No, because but
It's
you
easy.
know, some people live by this thing. You know, some people have it that listen, I want to go over the steaming because I want to tighten out them something. So we need to know, because maybe we're harming ourselves more than anything else and don't even know, don't?
I wrote an article about the steaming a couple months ago, and I got a lot of backlash for it. But again, I just speak in my opinion. You know, and again, I'm not going to say if Jane does it and Jill does it and Jane say it work. I'm happy that it works for Jane, but I'm not going to recommend it because I don't have no evidence to support it. You know, you can get burns, you know, you can change the floor of the vagina, it can predispose it to getting more infections or vaginitis or vaginosis. And I've seen it happen. I'm talking about what I have seen. I look after women for a living, you know, so women will come to me and say, boy, doc, I do this, and since I do this happened. And I was like, you know, I can explain that physiology, you know. I can explain why it happened, you know, but I can't explain how it tightened. But I can explain how these flavored steams can change your vaginal flora and cause you to get abnormal discharges and inflammation of the vagina.
Yeah, so let me say, you know, you take care of women for a living. Why, Dr. Daley, we can just imagine I come in your office and I say, boy, doc, you know, so the thing that in a tight, and in a pretty, more you fix it up. How do you get ladies to just come and just be at, you know, so be at ease to tell you all of them something, you know?
You know, a big part of it is I think for me is my personality and how I interact with people. And I always tell patients, or I always tell people that I'm talking to, I have 25 minutes to get as much information out of a woman as possible. You know, so I have to make the whole experience comfortable. A lot of women are a little bit naturally, they hold back a lot, but I try to break the ice quickly. I try to break the ice really, really quickly. I have certain techniques that I can use, like the social techniques in communicating to make the patient just feel comfortable, because the more comfortable a woman is, the more she will release, or the more information she'll give to me. And my whole purpose is to get as much information from you so I can properly manage you, right? So some women will actually come, I mean, because of Instagram and social media and all the articles I write in the newspaper, some women will actually come and they'll tell me straight up, just like, is that I want my vagina tighter, you know? Sometimes I have to pry it open from them, because I ask most women, I have a sexual gratification questionnaire. So like I came up with this questionnaire, so I can at the end of the questionnaire, I can kind of figure out if you have a mental problem with sex, if you have a physical problem with sex, or there's a complete disconnect between you and your partner. So I you know, so I can have an idea how to start. Like I tell you, I have have a limited amount of time to get as much information. So I'm going to get it. I'm going to get it from you. You know, I'm going to get it from you. So I mean, it just comes with experience. Every doctor is different. I know my style may be different from all my other colleagues' style, but I know what works for me, and I know I know when I do it, I get the information that I want.
All right, so I want to go into the meat of the matter.
Sure.
I just love using this word, the oku-bit and the
Oku-bit.
attractiveness and the, listen, you know what we want to hear about? The O-shot, because Dr. Daley, we think will come on and say, Dr. Daley, O-shot it for me there. Because, I mean, reading about it, it sounds really interesting. But
I can
let's
send you
take
some
our time.
information. Just remind me, I have a whole heap of information to send.
On the O-shot, all right.
Yeah, man.
So
I reached a point in my career, sorry to stop you, where I said, longer, like in my father's days, my father is a first generation OBGYN. Back in the days, whatever Dr. Daley tell you, I saw it go. You know, I have a different approach right now. I believe in educating and empowering women, and I will tell you my experience, and then I will give you all this information to read, and I will encourage you to go on Google in addition to what I give you, and you do your reading, and then after you have done your reading, you make an informed decision, and this is what you want to do. I never force people to do anything they don't want to do. I said, you can read this can happen, this can happen. When you make up your mind, you come back and talk to me. I'm not going anywhere. I tell people that all the time. I say, what's the rush? I live in Jamaica. I'm not going anywhere. I don't just read the information I give you, get the information, get the facts, ask any questions you want to ask, and then we can take it from there. You know?
So Dr. Daley, tonight, no, we're here to help some people and spice up them love life and change some women's life for good right now. Like all the women them don't want to look on them vagina. We're about to change up all of that for them tonight, right?
Yeah, man. Yeah, man. Which one you want to talk about first?
Wait now, we're gonna read the testimonial because you have to kind of just warm up the committee now. So this is a testimonial from somebody that you have done a vaginal rejuvenation. I'm just gonna add it. I just read some of it. Sex didn't feel like it used to. It just was. I just wasn't enjoying it as much as I used to. Coupled with that, the feeling of insecurity when having sex. So she consulted with you, and you did the surgery after telling her to do the reading of that, like you said. And she's saying that after surgery, it wasn't painful, and the recovery process wasn't painful either. And she said she took a while to have sex. Yeah, that come like when you have baby. She took a while to have sex, but when she did, it was like firework. She said that she was like a virgin again, and her partner was extremely happy. And she was saying the vaginal rejuvenation has given her back her confidence, and now she's getting ready to do the O-shot. So when you hear all of that, you say, well, hold on. No man, we have to go, we have to go talk. We have to go talk about it. So let's start off now with, I just be the umbrella thing, cosmetic gynecology. How new is this in the scheme of things?
In all honesty, it's not that new. It's about, really isn't that new, It's probably about 25 years, but again, it's still a taboo field, What cosmetic gynecology essentially is, it's the enhancement of the function and structure of the female genital organs. That's essentially what it is, right? So you make the female genital structures function better, and you make it aesthetically pleasing. Essentially, that's what is it. That's all it is. And the terminology, I mean, it's the godfather of cosmetic gynecology is the guy who trained me, Dr. David Matlock. He's in Beverly Hills. He's actually been doing it from like the mid-90s. He came up with the whole terminology, vaginal rejuvenation. It sounds fancy, but really it's not a new procedure that is new to gynecologists. Essentially, what a vaginal rejuvenation is, older women, again, because of this whole estrogen and the lack of tone of the vagina, they can have what we call prolapse. Sometimes the bladder can prolapse or herniate into the vagina. The bladder is on top of the vagina, and the rectum is behind the vagina. So sometimes the bladder can bulge on into the vagina. That's what we call a sister seal. Sometimes the rectum can bulge up into the vagina. That's what we call a rectal seal. Or sometimes the whole uterus can come down, right? So what vaginal rejuvenation is just basically so the vagina has four walls: top, what we call the anterior wall; bottom, posterior wall; and the side walls. And
I
what
think I have a picture. Let me see if I can find the picture right here. I was looking.
Yeah. So what vaginal rejuvenation is just what we call a posterior or anterior repair of the vagina. And essentially, what we do is the same procedure we do in older women. Is a three-step procedure. What we do, we reduce. Cause remember, I said the rectum is coming up into the vagina. So we push the rectum down. Right. That's the first step. Like almost like a hernia. We push the rectum down. Then we take the muscles of the vagina, right? We call it, that's the levator muscles. And we put the muscles over the rectum. We push it down. So we bring the muscles close together, right? And then the third part is the outside of the vagina, right between the opening of the vagina at the bottom and the top of the anus. That's what we call the perineum. So we repair the perineum. So it's a three-step procedure, right? So we push the hernia back in, we put the muscles close together, and we reconstruct the perineum. And that's a vaginal rejuvenation. That's a posterior repair. The same thing you can do for the top. If the bladder is coming down, you push the bladder back up, you take the muscles at the top, you put them together, and you just close it back up, right? So that is all vaginal rejuvenation. It's a posterior and anterior repair of the vagina, but it sounds fancy. So what he did, he just took this terminology and this surgery and applied it to younger women, right? And then he also did what he called design. So he called that laser vaginal rejuvenation. He uses a laser to open up the tissues. It's much better than a knife, less bleeding. And then he also calls the aesthetic part designer laser vaginoplasty. So the laser vaginal rejuvenation deals with the function. You're making the vagina smaller, right? So when you do that, the opening gets smaller, and it's also at an angle, right? So normally it's like this. When you do it, it's going to be like this. So you have to be going in like this at an angle versus like this. So when you're going like this at an angle, it can stimulate the G spot area much better, you know, and the friction is better, right? So that is what vaginal rejuvenation is. You're dealing with you're making the diameter of the vagina smaller, right? That is vaginal rejuvenation, posterior repair of the vagina.
All right. So the first one here, which is let's talk about because I'm like, yo, this is supposed to be painful. The labiaplastic.
Labiaplastic, yeah, man.
Yeah.
Labiaplastic, yeah. Yeah. So again, that is how Dr. Matlock the terminology he uses that we call designer laser vaginoplasty. The most common one is designer laser vaginoplasty. The most common one is a labiaplasty. You have other things that you can do to make the outside look pretty. So you can do a labiaplasty. That's essentially what happens. The inner lips, by definition, the labia minora, is not supposed to surpass the majora. So you're not supposed to be, you're not supposed to be looking down and seeing the minora coming out, right? So if that is coming out, that's what we call labial hypertrophy, which again, as we mentioned earlier, could be a genetic predisposition, right? And sometimes that can get in the way. Sometimes some women labias are just longer than others. That's how you're born, you know. It can get in the way with sex. It can get in the way with exercise. Women don't want to wear certain clothes because it's going to look, you know, they don't want to get, they don't want to get too much. They don't want to get too much attention. Yeah. So what a labiaplasty is essentially you're making the inner lips smaller than the outer lips, right? That's a labiaplasty, right? That's one of the, you can cut down the lips, you can make the outer lips bigger, you can do a whole pelvic lift on the outside, you can just do the perineoplasty alone. I mean, a lot of times some women, you just have to do the outside alone, you don't have to do the inside, because once you make that opening smaller, a lot of women, 75% of sexual gratification comes from the entrance of the vagina. So when you talk to the women and I get some more information from them, a lot of times you really don't need to do the full repair. You can just do the outside and they're fine. You know, so everybody is different and you have to get the information from them. You know, so a perineoplasty is actually a designer laser vaginoplasty, because some women may not like how it looks. Boy, that since they have the baby, may not like how it look. Fix it up for me down there. That little area alone. You know, and then when you fix it up, you know, like I had a patient the other day, she had a episiotomy. That's when you cut to get the baby come out. And it didn't heal up properly the way she wanted to heal up. So I just fixed that area for her and I gave her a brand new perineum. And the sex got much better. She didn't think she didn't go in there for better sex, and she went in there because she didn't like how it looked. And then the sex was a bonus part. So all I did was just reconstruct that little area there, and then just the mere fact you reconstruct it, you make the hole smaller.
All right. So I know when the inner lips longer than the outer one, as you were saying, you tend to have issues, maybe pain when for you. You also have vaginal VTI that you can also get from that, right? When you do the outer one now, how you get the outer one to be like to get bigger? Where you do like inject it and make it get fatter or something?
Oh, so yeah, so the two main ways you can do that, you can do fat transfer. So all the fat you suck out after liposuction, you can just put it in the outer lips to get it. That's what we call labial augmentation. Or you can use filler, like the same thing, Botox, and you mix it with a little PRP. We're going to talk about the PRP, but that's for the O shot. You use a little bit of so you take the patient's blood, PRP is platelet-rich plasma, and you harvest the plasma, and you mix the plasma with the filler, right? And you can get a little. It's not going to get this big augmentation versus the fat, but it's very subtle and it's very aesthetically pleasing. That's what we call a vampire wing lift. That last vampire wing lift, right? And the vampire facelift is the same principle. PRP in the face with a little bit of filler.
How long does that last?
I can last for about 6 months. You know, 6 to 12 months. It varies, just like regular Botox. Botox can last for about 6 to 12 months. It varies, you know. Sometimes as long as 18 months, you know. But I tell patients at least 6 months. You see the full effect of it at 3 months, and it can wear off a little bit after 6 months.
All right. So, I mean, some ladies may be vain and look on them the vaginal region and say, I like how it look and I want to sort it out. Let's do how many persons actually have you see that really would have an issue, a serious issue, versus those who just want pretty up.
You know, the truth is the bulk of my work is still basic obstetrics and gynecology. You know, I still do a fair amount of cosmetics, but my bread and butter is still basic pregnancy, basic fibroids, basic well woman visits. But when a woman comes, because it's cosmetic surgery, so you really have to counsel these patients adequately. You know, you have to say if they really want it for them. You know, if they're doing it for them, the biggest thing is the patient have to do it for themselves. They're not doing it for them husband. They're not doing it for them spouse. Because I find, and I've been the patients I find who are not happy with results are the ones who do it for their spouse. So I you know, when I just started out in my younger days, I just, you know, and those women weren't happy, you know, even though you do the same thing, I guess it's not the results that they wanted, you know, but it's a very thorough counseling process. And once I am happy that I feel that you really want it or you think you need it, I'm going to proceed. You know, but if I'm not happy with it, I'm not doing it. If I don't feel you need it, if I don't feel you're doing it for the right reasons, I'm not going to do it. I mean, it's not going to affect my living, you know. So, I mean, and as a doctor, I have the right to say I'm not going to do the surgery if I don't feel like doing it. You understand what I'm saying? It's not about the money. It's not about, if I don't feel you're a proper candidate, I'm not doing the surgery. For whatever reason, mentally, psychologically, physically, if I don't think you're not ready for surgery, you're not fit for surgery, we're not doing the surgery.
Okay. All right, what age group do you see coming in for this type of surgery though?
Mostly mid-30s, late 40s. I've done a couple 20-year-olds.
20-year-old?
You know, and like, I just remember I saw a young girl this other day, and I told her, when you're 30, come back to me, you know. You know, she wanted a Labiaplastic. I said, just enjoy. She wasn't even that sexually active. I said, enjoy your life first, and when you're 30, we can talk again. You know, again, it's life changing, it's body changing. You know, you have to be in the right frame of mind. You know, you have to be in the right frame of mind.
So you say as you get older, it sags, right?
It
Is there
can
a
sag. I didn't say it. I said it
can?
can sag.
Why? There's something that
You have to
distress me.
care, no, you have to careful with the terminology you're using because people will use it and come back and say Dr. Daly said this and Dr. Daly said that, you know. So
All
you have to be
right.
careful how you word it. It
All
can.
right. Okay.
Hmm.
So when you get older, it can sag. Is there a cutoff age that you say, all right, no, I'm not do it. You're too old for this type of surgery?
For which surgery? The rejuvenation?
No, the labia.
No, I mean there's no cutoff. I've done it on 50-year-olds if they just want it to look better, you know. They
Mm-hmm.
reach that point in their life. I mean, once you're surgically fit and you're mentally fit and you're doing it for the right reasons, I'll proceed. You
Mm-hmm.
know, I'll proceed. You know, the labiaplasty is easy. It's not hard. I usually tell I do it in the office, right in the office. Just numb the area and you just trim it down right in the office. It's not as hard as we think it is. You know,
Tell
and
us
there are
about
other
the
things.
process.
Well, you essentially what you're doing, you're trying to. There are different techniques you can use, all right, to cut the labia down. But the way I was trained, I use a linear technique. Basically, there's a technique you do to line it up properly, and you just basically trim off the excess labia and stitch it up. And it will. I always tell patients it looks much worse before it looks better. Like around like 4 or 5 weeks, you're gonna say this looks horrible, you know. But usually, like by the time you reach 6 to 8 weeks, it looks very good. But the best time is like 3 months after surgery. All cosmetic surgeries look better at 3 months. You know, so essentially, most of the time I do it under local anesthesia. Like you go to the dentist, we just numb the area. A little painful the initial numbing, but once we numb it, you don't feel anything. It's a 25-minute procedure. A simple labiaplasty is 25 minutes. It's not
So
long.
a lot
It
of
doesn't
people
take a
saying
lot
the
of time.
trim down. And the trim down part I get to be. You know,
Yeah.
trim down is a look on a tree where you trim.
Well, when you remember, I use a laser and I don't use a scissors. So I use a laser and kind of the laser evens it out well and it's a neater cut. And that's essential. That's the best term. Trim down your hair, you cut your hair. That's essentially it. You cut it down. You know, whether some doctors use scissors, some doctors use knives. I use a laser to cut it down.
Mm-hmm.
You know,
Mm-hmm.
so and you have different techniques. You know, but the one that I was trained is a linear technique, and I find that he was the best and it's easiest when you can do other procedures. You know, you can I don't do a lot of work around the clitoris at all, but you can reduce the skin around the clitoris. I don't like to mess with it personally, you know.
Mm-hmm.
So, but the designer procedures that I do are the labiaplasties and the perineoplasties. I do a lot of perineoplasties too. A lot of perineoplasties.
Mm-hmm.
I do more perineoplasties than I do the full repair. Because remember, I
Oh,
said
really?
a lot of women can get away with it. Remember, talking to you, I can know what your problem is. I want to examine you. So, like, I can examine you and your tone is good on the outside, you
Mm-hmm.
know? But the problem is on the outside. Your tone is good on the inside, but the problem is just right on that little area outside, you know? So
Mm-hmm.
talking to you and they're talking about boy doc, you know, when my spouse having sex with me, like the penis will drop out easily. Usually that suggests that there's a lack of tone on the outside. You know, so talking to you, I get a lot of information, you know. And usually, like, if you don't have any problem, I don't trouble you, you know.
Mm-hmm.
Like for rejuvenation. If you're
Mm-hmm.
enjoying sex, if you're loving sex, if you're climaxing, you don't have no problem, I leave you alone. Remember, I said the women who come and said that something is wrong, you know, you listen to those, but the women who have no problem, just leave them alone. You can actually do more harm than good. Why trouble something that's working? You
Yeah.
understand? Leave it alone.
Yeah.
Leave it alone. Just leave it alone. I said, well, I'll tell the patient, you don't have any problem. You're all right. I don't think I need to
Mm-hmm.
trouble you. But doc, I said, well, you can go somebody else. I don't think I need to take your money right now.
Mm-hmm. How many persons do you get on a monthly basis coming to you for this type of surgery?
About how many I do or how many I
Yeah, how
get?
many you do? Do.
I probably do about 5 a month.
Wow.
You know, but this is everything, you know. This is anything cosmetic. Could be, and I consider the labiaplasties, the perineoplasties, the full repairs, the O shots. You know, I don't really call them the O shot. I'm not counting the O shot in that, but like surgical, most of them are minor. And I tell you, I've been doing a lot of perineoplasties, and you can do that in office. You know,
Mm-hmm.
that is getting very popular right now. I find, you know, it is very, very popular. You can do it under local and you get the look and you get the feel of what you want. You understand? It's done right in office. And again, that takes 20 minutes. It's a 20-minute procedure.
20
Done,
minutes.
finish, and it looks 20 minutes. The full repair is about an hour and a half. And I don't do that on a local. I have to carry it to the up to the hospital or the day surgery center and we do it, we put you to sleep or we give you a spinal. And some women, if they want, some women want everything, you know. So some women they want the labiaplastic and they want the full repair, you know. So you have to carry those patients. I do the full repairs in office. I do the full. It's too. The patient needs to be fully relaxed for that surgery, you know. They need to be relaxed. You can't be jumping off the bed and all of that, you know. So you have to be relaxed for that. But I'm doing a lot of perineoplasties, you know, a lot. And I would say probably for the month, I'd say about probably like 10 to 15 patients who come for that, for who a lot of them don't convert to patients, you know, but I mean, or to surgical procedures, but they'll come and they'll ask about and inquire about it. But that's not still that's not the bread and butter still, you know. The bread and butter is the pregnant patients, the fibroids. That is my bread and butter. You know, the cosmetic stuff is a bonus. You know,
But would you say it's growing?
Definitely. With exposure, with social media platforms, with people reading about it. Just like when I talked to my mentor when he just started out, he was frowned upon doing it. And I know that's all he does. He does everything. I mean, he's a gynecologist, but he does breast, he does liposuction, he does everything. You know, he doesn't do any gynecology, any general gynecology. I'd love to reach there one day, but I don't think Jamaica reached there as yet. You know, and I still do have a passion for general women healthcare. You know, even though I love cosmetic gynecology, I still love looking after women generally. You know, it's not really about the cosmetics. That's the bonus part. Yet, you know.
The labiaplasty, right? Can you like do that and then like just take like your lunch hour and do it and then go back to work?
You're going to have a lot of pain after. I mean, normally you do it. I tell it to take I give you about 2 or 3 days after, off from work, you know, and you're good to go. Like in 3 days time, you can, you know, you're good to go. You're good to go. It's a quick procedure. Just think about it. Think about like when women give birth and you get a slit and they stitch it up back, you know. It's a similar process. Down there is a very rich blood supply and it heals very, very, very well, you know. So normally we do it and normally bring it back between days 4 and 7 because sometimes the stitches can break down and, you know, so you have to examine them and you see, but you just a lot of times, even though if the stitches break down, you just leave it alone. They'll heal by them. It heals so well. You know, it heals so well.
Wow.
It's a very forgiving organ. The uterus and the vagina, very forgiving organ. Very, very, very forgiving.
So how long after you can do it?
6 weeks, at least. At least. So normally we examine you and some women take longer than others, you know. So when I examine you, some women have delayed healing. Some women, you just have to watch them a little closer. And usually by 8 weeks, everybody is fine. You know, usually by 8 weeks, everybody is fine for the labiaplasty. And the same thing for the repair and the perineoplasty. But some women really heal really, really well. Like I remember thinking about this girl right now, like she healed so well. Like by the time she came for a 6-week visit, so you're supposed to come for a 6-week visit and then I'm supposed to give you the clearance for sex. When I saw her at 6 weeks, that we don't do that already, everything working good. You know, and that can be a problem if you do it too early, you know, it can break down everything, you know, but this particular patient, she healed very well. Like, you know, you have those patients and then you have the ones that take a little longer, you know, and sometimes, you know, you can have a little bit of wound breakdown in those but I would have said 99% of everybody comes back and heals very, very well. And most people are satisfied. Most people are satisfied.
With the rejuvenation process, it's the same 6 weeks,
Yeah, man.
thing, right?
So any surgery is 6 weeks. Appendix is 6 weeks. Breast is 6 weeks. The body takes 6 weeks to heal, right? C-section is 6 weeks. Everything is 6 weeks, right? So unless you're doing like minimal invasive surgery, keyhole surgery, but that's 2 weeks. But the body takes about 6 weeks, and the perineum will be usually fully healed. So when we're examining at 6 weeks, if you're still a little tender, like we're talking about the rejuvenation right now, if you're still a little tender in the perineum, I'll normally bring you back in 8 weeks time, right? And what I'm doing a lot of now is, and I've just started doing it this year, is combining the surgery with physiotherapy. So I'll let you get at least 2 sessions of physiotherapy after the 6 weeks, and then when you come in at 8 weeks, I'll check you again, and then I'll give you the clearance for intercourse. Because a lot of times that first time you have intercourse can be a little painful, you know.
That's what I wanted to ask you.
That
Because
first time
some
you have,
ladies like it, some ladies like it
yeah, man.
a little oversized.
No, man.
So that
You
will
have to.
just break down everything.
No, man. It's not a matter. It's not gonna. But when it's healed, it's not gonna break down, you know. But sometimes it can be a little uncomfortable because you have decreased the diameter so much. It can be a little uncomfortable. So like I counsel the patients a lot, like, look, the first time you have sex, you have to use a lot of lubrication. It's going to be uncomfortable. It's going to take about a week before you start enjoying it. And what I found, when you implement the physiotherapy before they start having sex, they don't have that complaint again. You know, they don't have that complaint again. So normally 2 to 3 sessions of physiotherapy, the physiotherapist will teach them how to, it's a process, how to enjoy sex, how to be less anxious with everything, and and they have dilators that will help dilate the vagina, and it can match the size to your partner, and it helps out a lot, So I don't know, even the perineoplasties, I send it for physiotherapy. It's a part of my management all the time. Physiotherapy is a part of it. The two of them, it's 1 + 1 = 3, not 1 + 1 = 2. It's a synergistic effect.
With the
But 6 weeks,
rejuvenation, do you have, like, is it a case where you have persons coming back and say, okay, you did it, I'm gonna go road, I'm gonna take on when I can't manage, I'm gonna come back again and do it again. Do you have that?
No. I would say most of the time, the people who I say who are not satisfied, which is very rare, like I'm only thinking about 2 right now, are the women who did it for their husbands. Because I do the same technique every time. It's a basic procedure. It's the same thing. It's just like you go in the car and start the engine and put in drive, and it's the same thing you do. But sometimes the road might be a little bit rocky. You might have a little pothole. It's the same thing. The surgery may be a little rocky, but at the end of the day, you get the result that you want. And I don't over tight, because you can make it very, very tight. But I just use my discretion, which is very simple. You measure it up and you examine after, and you can feel the tone after. And you don't overdo it. You don't want to overdo it.
That's what I wanted to ask you. We mean discretion. So how like a woman is supposed to be like a $5. Hold on, you gone. Me not hear
you. You cracked up a little while ago.
Oh, I'm hearing you now.
Okay.
So how do you know the size to give the woman?
Discretion. Most women, 2 fingers is comfortable. I mean, although some people say they don't want it tight. Just use, after you do so much of them, what's normal, You don't want to overdo it. 2 fingers tightly, or it's this, the average penis is 2 fingers, right? I don't care what any man say. This is the average penis right here, right? So you want it to make, so when you're doing the procedure, you use your markings, and you want to make sure it can comfortably take, and remember, it's a muscle. It's going to stretch again, but not to how it was before. So it can accommodate more with time. So you just want to make sure it comfortably can accommodate 2 fingers, right? And you can feel it. You can feel the tone how it was before. I mean, it could accommodate 2 fingers probably before, but when you finish, you can still feel the tone, and you can feel the muscles are much firmer. So it's a lot of it is experience. Most of it is experience.
I want to ask this question. Well, them say no question full, but me just want to answer one here. Is it true that if a lady has sex with a man with like an oversized dick, it can stretch out, it can stretch out her vagina?
Definitely with time. The more you do it, for sure.
Over time, consistent.
Of course. It's a muscle. It's going to stretch. And the question is, will it come back to how it was before? It may not. You understand? But if you're putting this constant pressure on the vaginal walls repeatedly, you're going to have some kind of pelvic floor relaxation.
You hear that, ladies?
You understand? It makes sense though. You're going to have pelvic floor relaxation after a while. That's trauma to the pelvic floor. You know, it's the same thing when a baby come through. It's just that a baby is much bigger than the, and the thing is, you know, what works in a pregnancy's corner is that you have the circulating hormones of pregnancy, and what normally happens, the vagina naturally gets bigger when a baby. I mean, I don't know how much of you guys have actually seen when a baby is coming out. The vagina naturally gets bigger, right, in anticipation of this baby to come out. Right, and trust me, when that baby come out, it's a different vagina when that baby come out. You understand? And within 6 weeks, it's back to how it was before. As I said, it's a very forgiving organ, right? But the pregnancy hormones definitely help to accommodate a baby, you know, versus if there's no pregnancy hormones there. You understand? So when you're pregnant, the body is anticipating this vaginal delivery, so it's getting ready, and especially when you go into labor, man, that vagina mutates, boy. Trust me. When you see that thing just change in front of your face, like, wow, I can't believe this is happening. But God made you guys really well.
Well, I'm going to tell you. So, ladies and gents, if you have questions, now is the time. I'm going to go to the O shot. But I know you have your question that you want to ask Dr. Daley. He doesn't have a lot of time, and I want to get all the questions in. So, you just send it in the question area, and we'll just have him answer as many of them as he can. In the meantime, because I see some of them asking about cost, do you discuss cost like this?
No cost is discussed online because everybody is different, and the amount of work that is required for Dara, maybe the amount different from the amount of work required for. So I that's one of my pet peeves. Cost, when you come in, assess, and we can take it from there. Because everybody is going to different levels of work, you know. You know, so what I do for a perineoplasty, depending, I repeat, suppose I'm doing, the other day I did a repeat, I did a revision surgery. She did a repair about 8 years ago, and she came back for another repair. So I'm not going to charge the same amount of money for that one because that's more scar tissue, but no matter about the cost. We can discuss it then and there.
So I was talking to a girlfriend of mine, and she said, ask him if he does group rates. Because we could have a girls' day out where all of us come and say, Dr. Daley, rejuvenate.
We could work out something if it's a group rate, you know. But I mean, like I said, it depends. The group, everybody in the group going to be different, so it's kind of hard, you know. The cost varies, you know. That's the honest answer. And if you ask any surgeon that, it doesn't have to be cosmetics alone, right? And just like doing a C-section, a C-section, a regular C-section is different than somebody who has had 4 C-sections before. The price cannot be the same because they're going to have more scar tissue. It's going to be a more difficult surgery. You can have more complications. It's the same principle applied, but just a different part of the body. So the price for patients vary. It's going to be different, right? Because patients will come to me, oh, how come you are charging me this, and my friend come to me and you charge you that? I say, well, because you're different than her. You understand? So everybody is different and everybody is individualized. And we can take it from there when we're in the office and we can talk further.
All right, so this is the part that really interests me. And if you want to have somebody in a testimonial, I will volunteer to come get my O shot. Because when you know, so let's talk about it. You know, a lot of ladies don't even know what an well, they talk to you, I should ask you. Do you hear the complaint that a lot of ladies don't even know what an orgasm is?
No, a lot of, I wouldn't say a lot. I would say probably about 1/3 of women haven't experienced an orgasm. Yeah.
Can you imagine you having sex all your life and you don't know, you don't experience that? All right. So the O shot now. The O shot now is supposed to bring back all of that, bring back the wetness, and bring back, you know, stimulate increase the size of the G spot and the clitoris and all of that. Tell us about that one, because I am interested in that one.
Yeah, man, I love the O shot because you get good results with it, and it's a quick procedure. You know, it's very, very quick.
First of all, tell us what it is. Tell us what it is exactly.
Yes, so just about to say that. So what the O shot means, orgasm shot. So I always start off by saying the blood has different constituents, right? you have different constituents in the blood. You have the hemoglobin, you have the red blood cells, you have the white blood cells, you have the platelets, right? So the platelets are the part of the blood that they're like the soldiers of the blood. If you get an injury, in surgery, if you get a cut, the first thing that comes on to the site is the platelets, and what they do is start repairing immediately. So if you get a cut and the scab formation, is the platelets causing that. So they are working very, very, very hard. They are one of the key parts that starts the clotting, right? So what platelet-rich plasma? So what the OSHAT is, we're harvesting the platelets from somebody, right? And we're going to inject it back into an area. The first people that used to use it were the orthopedic surgeons, and they still use it heavily, right? So they used to use it in the joints for arthritis, right? So they take the blood, spin it off, harvest the platelets, the platelet-rich plasma, and inject it into the joints. And what they found was that women or men who had arthritis, the pain would be improved. And the same thing, the dentists do a lot of PRP, and the dermatologist use it a lot, right, in the face. So this guy now, Dr. Ronald, said, I wonder what would happen if I put it in the vagina. And what he found out was that a lot of things happen when he put it in the vagina. A whole heap of stuff happen. So what you do, you get this platelet-rich plasma, you inject 1 cc or 1 mil into the clitoris, and you insert 4 mils on the top of the vagina, right? 2 mils in the G spot and 1 mil, and like you just want to get it at the top of the vagina. And what will happen is that the PRP you'll naturally get a volume response. So you're pushing more stuff in it, so that the G spot will naturally get bigger because of volume. And when it's bigger, you're going to get more sensitive, just naturally by that. But the platelets will start to work in the vagina, will start to work underneath the bladder neck, and what will happen will start to rejuvenate the tissues in there, right? So what will happen, you'll have increased sensitivity, especially because I'm putting the clitoris, and in the vagina, naturally the vagina doesn't have a lot of sensation, naturally. It doesn't have a lot of, naturally it doesn't have a lot of nerves. Compared to like the clitoris on the outside of the vagina, there's not a lot of nerves in the vagina, all right? There's not really a lot of nerves. So you'll get more sensitivity, you get increased blood flow, increased lubrication. If you have stress incontinence, it will help with the stress incontinence. And it can increase the intensity, frequency, and the ease at which it can achieve orgasm, right? But I find most of the time what people really get from the OSHA definitely is the sensitivity and the lubrication. 60% of patients, that's what they said. Boy, this doc, I don't know what you do, but down there is crazy. Yeah, man, there's a river. And I normally combine that with heat energy. So you can use, so you combine that. So I normally describe, so the OSHAT is the chemical arm, right? And then normally I use heat energy in the vagina. I normally use ultrasound energy. And I recently got a different kind of laser energy, what we call fractional CO2 laser. And what this heat energy does, it breaks down the collagen in the vagina and restructures it at the same time. So the two of them are working synergistically. So the heat and the OSHAT working together to get your, the desired results that you want, right? So, and like I said, if you Google it, you're going to see a lot of stuff about laser vaginal rejuvenation, which theoretically is what Dr. Matlock talk when he use the laser. But if you Google laser vaginal rejuvenation, you'll talk about people putting this laser in the vagina to tighten the vagina. And sometimes at the bottom of the list, at the bottom of the list, you will get some tightness. I don't push it for tightness, right? If you want tightness, you do the surgery. Right. But you will get some tightness when you do the laser and the HIFU, right?
Yeah,
and it
because
works really well.
Because everything else is increasing around it in terms of the size. So automatically, that's where the tightness will come in, right?
Yeah, I mean, everything will, the tone will get a little better, but it's not long standing, it's not long standing. It's not long, the tone is not long standing, but all the other things are long standing you can get at least up to 18 months, yeah, man, it works really well. And obviously it
so
works.
So imagine 18 months to improve sex life with just one shot?
And sometimes, again, it depends what you're treating as well. Some women may need 2 shots. Like 4 weeks apart, right? Like women who have difficulties climaxing, right? Women who have a mixture of bladder problems as well. It's a lot of stuff. You have to, again, that's why you tailor your management for patients. Some people just need one O shot alone. Some people need the O shot and the energy. Some people need the O shot and the energy and the laser. You know, some people need 2 O shot and the HIFU and the laser. Everybody is individualized. What I found usually though, I normally give the O shot, standard O shot and a HIFU, and it works very, very well. Right? Because before I started doing the O shot, I was just doing a lot of energy, and I was getting very good results with the energy alone. And when I add the O shot to it now, it's much better. But the O shot works. It's good.
So you
You
do
will
the
get the
O
results.
shot and you can go home same day and go and go
Oh
do
yeah, man. It's normally I tell you wait about 3 days for the swelling of the tissues to go down. You
Uh-huh.
know, but after that you're good to go. You're good to go. Within 3 days, you're good. And it's 15 minutes. It's not the longest part of the O shot is preparing the blood. That's the longest part. Preparing the blood is the longest part. And as I said, so normally while the blood is being prepared, my nurse normally prepares the blood, I normally just giving you the laser and a HIFU in the meantime. So by the time we finish that, we're ready for the O shot.
So
As the blood is
the O
prepared.
shot now, as breeze blow upon you feel
I've
it.
had a patient one time, she said, boy, doc, I don't like what you do to me, I come too quick, I don't like this. So it varies. Remember, you're making the platelets are working on the nerve endings in the clitoris and the nerve endings in the G spot to give you this big orgasm or this big blast that you want.
Mm-hmm.
Some women may squirt too as well. I've had that too as well. So
Yeah.
there's a
Yeah,
lot of
because
stuff.
some women that's an issue for them, So I think anything that can get them, because I mean I think there's so much about sex that people just really don't get to experience because maybe of inexperience on themselves or their partner, are just not knowing where to touch and what to touch. So if
Yeah,
you
man.
can do something nice to make us breeze blow upon them, so them it's supposed to be murder.
Men need to learn, and that's when the sex constant come into play. But that's another discussion.
Because I'm open the floor for questions about it. You have some other things you wanted to say about the OSHA?
I think that's essentially it. Nothing really much more. I mean, if you go on my page, there's some information there. Can send information. It's pretty straightforward.
Mm-hmm.
Success rate is 85%, right? 85%. Everything has a failure rate, unfortunately, and that's why
Really?
it's very important. Yeah. Everything has a failure rate, but for the most part, like I said, some women will want the orgasms, and if they're not getting it, I'll probably give you another O shot. But everybody that I do the O shot to says lubrication and sensitivity, like 60% increase. And stress incontinence, I almost want to say 99.99%. I want to say 100%, right? Mild stress incontinence, women who like laugh or cough, I've had like 100% cure rate with that.
So some
100.
people body stubborn that you have to do 2 shots?
Yeah, man. 2 works better than 1.
No,
Remember,
can
if
you
you're good
imagine
enough,
2
2 works
shots?
better
You
than
can't
1.
walk them time there. As you walk, it's like a explosion.
So it's an
Bish.
easy thing. No, but you don't do the 2 shots same time, and you do it like 4 weeks apart.
Ah.
3 to 4 weeks apart.
Uh-huh.
3 to 4 weeks apart. And remember, it's not really a shot per se, it's an injection into the clitoris, and you inject the top part of the vaginal wall. And then you come back again and we do it again. There's no such thing as giving you too much O shots, because there's no limit on it. It's your own blood that we're putting back into you. So there's no limit. But the more you do in a certain time span, the better the result's going to be.
But like that.
The evidence has proven it. But
I like
the
that one.
evidence
Me
has
not
proven
give
it.
you no lie. I like that one there. I mean, anything like that. Because people don't realize, in this stressful time,
And
anything that can de-stress you, you should go for it.
and you have the P shot too. You can put PRP into the penis to get the girth, and yeah, man, to get girth and to prolong sexual intercourse.
Hold on. Pull up. Ladies,
P shot.
tag the man so them here at
But
one. Come on. Share the
but me
live.
not done a P shot though, yeah. So let's get that clear first. Let's get that clear. We're not done a P shot. I don't say no men. Only women.
But there's hope for them, right?
Yeah, man.
What? Yo,
Man, so
there's
the
so much.
P-shot can help. It's a lot of information. And these stuff are stuff that weren't taught us in medical school, you know. I had to go out, I had to learn it, I had to invest in myself, I had to go abroad to get trained, I had to go abroad to get all this education. You know, this wasn't taught to me this wasn't a part of my training as a gynecologist. You know, to the point that I'm teaching the young doctors about this right now. You know, I'm going back to them and say, look, this is a established. You know, the other day they had a cosmetic gynecology, what was it again? Module for the young gynecologists, and I was helping them prepare it. You know, telling them I was a moderator for it. You know, helping them because it's an established field right now. You know, we have to people. It's more than about looking. It really helps with women's overall well-being.
Yeah, so digressing a little bit, but who would the male go to for the P shot?
A couple of people do it right now. I know there's 3 people I know who do it. Dr. Sandra Knight is one. Dr. Karen St. Clair is one. And Dr. Simone French. How could I forget Dr. French? Dr. French was a big part of my OSHA. She taught me a lot. Even after I got trained, she kind of helped me perfect it. Yeah, so those are the 3 people I know who do the P-shot off the top of my head.
Nah, man. So you see, there's so much to do to help in your sex life, in your overall health and wellness, people. You need to go do research. Because me not hearing no like Dr. Daley. Me never know about all of them something here. But me know one
stuff there, man. Interesting.
Yeah, man, there's one that has my interest. There's one that has my interest. Oh!
Yeah, man, the O-shot. I know what I love about the O-shot. It's so quick and it's so easy. But how I tell women, you have to wait a while. You may see it may take about 6 weeks to see the result. So what I normally do, I'm giving you the heat therapy like every 2 weeks. So by the time you reach the 6 weeks, you get the results that you want, right? So by the time, you know, so I would say by 6 weeks, most women get where they want to be. It's not a light switch. Some women may say immediate response, you know. Some women may say because of the whole volume effect, right? But the true effect takes about 6 weeks. So it's very important to counsel the patients, you know. You know, it's very, very important to counsel the patient on what to expect and the failure rate and all these stuff. And we may need to give another one, and you know. But I really enjoy. I do a lot of PRP work too, like even when I am doing my labiaplasties. And like I said, sometimes it take a little while to heal. I'll just inject some PRP in there to help with the healing. The perineoplasty, I'll inject. I do a lot of work with PRP. A whole heap of work with it. I use it a lot. I use it a lot down there. Not just for the O-shot. Whole heap of stuff I use it for down there. The wing lift, I do the MONS, you can inject it into that's the ear, what we call it, over the bladder bone to make it get more bulky. There's a lot of stuff you can do with it. There's a lot of stuff. And the thing is, it's safe because it's your own blood. It's not going to happen to you, you understand? I like it. It works very, very well, especially with healing. Very, very well down there.
All right, so let's get some questions because I know you soon have to go. So I see about 30 questions.
Music I play downstairs already.
No, let me just hurry up and get all the questions in for you. Let me go in. All right. So this question: would you recommend O-shot for females with that one there?
Bartholin. I mean, again, that's completely different.
Tell us what this is, Doc. What is this first?
Bartholin is a swelling in the Bartholin's gland. That's the part of the vagina that helps to get lubricated. So would normally have to treat that cyst. I would treat the cyst before any O-shot. But sometimes I use a PRP to treat the cyst as well. Like I said, talking about a Bartholin cyst, that's a long topic. But essentially, it's a collection of fluid right at about 5 o'clock and 7 o'clock at the opening of the vagina. And those are the glands that supply secretions, part of the glands that supply secretion for sexual activity. And sometimes you can get a blockage and you get a cyst forming, and it can be painful. So you normally have to treat that first before you do anything else. So that's basic gynecology. And sometimes you can use a PRP to inject it. I normally put some PRP in there to prevent it from coming back.
All right. So how do you get the blood to do the O-shot?
Simple. When you go, just take the blood. Normally take 20 cc's. That's 2 tubes. You know, we just take the blood just like you going anywhere to do a blood test. We just take the blood, pull the blood and put up 2 test tubes, and 20 cc's can give you, you need 5 mils. So 20 cc's give you about 5 mils. So it's a lot of, it's a hectic process to get the blood, right? Just get this small amount of blood from this. You pull off all this blood and all you get is this. You know, but it works. Sometimes if you want to use more, you have to take 4 tubes. You know, so like if I'm doing like, sometimes I'll do the O shot and the vampire wing lift. I need 4 tubes of blood for that. I need 10 mils. I need 10 mils to do that. You know, so it depends what you're doing. You're going to need more blood, but you do get a lot of PRP from you need a lot of blood to get a small amount of PRP.
All right. Is getting the O shot a repeat procedure?
We spoke about that earlier. Yeah, you can get it. And normally, like, everybody is different. Sometimes it's 18 months. Sometimes it's 6 months, 6 months time. You know, they feel it wearing off. You give them another one and give them some more heat energy. Everybody is different. I had a patient that lasts for 2 years. Yeah, man. Oh, yes.
Would the O shot help someone who doesn't get turned on easily?
Definitely. It helps with libido. I can't explain that one, though, but it helps with libido. It helps with libido. It definitely helps with libido.
It's like when breeze blew up on you, you're gone.
Yeah,
That's what he's trying to say.
Probably is that. It helps with libido, definitely. Definitely. And those women with libido, I normally recommend 2 shots. So women who have problems climaxing and libido, I normally recommend 2 shots for you. In 4 weeks, over 4 weeks.
All right. Why do I feel tired after squirting?
A lot of energy, a lot of mitochondria burn, a lot of energy after that.
Come like she set out a river right there.
Yeah, man. A lot of energy. You burn a lot of energy. A lot of energy is burned. Mitochondria is a part of the cell that release energy. Orgasms alone release a lot of energy. So that can explain that fatigue.
What are some of the causes of orgasm problems?
Broad category: mental problems and physical problems. Mental meaning psychological. You may have problems in your relationship, and you have to rule out a physical problem. Is there a mass in the vagina? Why is the vagina dry? Does she have any problem with the vagina why she can't achieve orgasm? So remember I told you about this sexual gratification questionnaire? I can get a lot of information from that before I examine you. So a lot of times I can know if you have a problem in a relationship without even examining you. And without even examining, I work very well with the sex counselor, you know. So I'll say go to the sex counselor, and then if she can't sort it out, you can come back to me.
All right. What's the price for the O shot? Do you have a standard price for that, or it depends on the person?
It's usually a standard price, but as I mentioned, I don't recommend the O shot alone. I normally give it with heat energy. But you can Google the price for the O shot. My price is still there. Whatever I see it in the US, that's how much I charge. I keep that price standard. But you can see that the O shot price is standard usually. But I don't normally do O shots alone. I normally combine it with heat energy, as I said. So, but the O shot price is standard globally. So that price doesn't really change.
So bacterial vaginosis, somebody wants you to touch a little bit on that.
Okay, bacterial vaginosis, the vagina always has bacteria in it and yeast, about 1,000 organisms, and they're normally kept in balance. Believe it or not, there's bacteria in your nose, ears, mouth all the time, and whenever that balance changes, you can have overgrowth of bacteria, and they can get a bacterial vaginosis. Normally gives you a fishy odor, gray frothy discharge. Things that can cause it, it can be sporadic. Believe it or not, it can just happen without you doing anything. A lot of women have that it's hard to grasp that concept, you know, because they always say if this happens, something must have caused it. But a lot of times, something doesn't cause it, you know. But like the type of underwear you use, using scented soaps on there, not exercising well, not changing your pads well, all quickly or frequently, all these things can predispose you to getting bacterial vaginosis. But if you think you may have it, go to your doctor for an assessment and we can take it from there.
What can be done to increase libido?
The O shot and sex counseling, that's the normally do.
Mm-hmm.
You know, and again, you know, a lot of times libido really comes from relationship problems. I find, you know, if the
Yeah.
woman is off, she's not going to be into intercourse at all.
All right. So I want you to give them. I mean, he's accessible on IG, but they're asking where
No,
you're located.
my main offices are in Kingston and Portmore. Gyne Associates. Kingston is Tangerine Place. Portmore is Portmore Town Centre, and I'm in Maypen office, MediSearch Center, 2 Mondays for the month. But those are my offices, 3 offices. All my information is on my social media. So all my office information is there, and my email is there. I encourage people to email. I don't encourage people to DM me because other people have access to my DM. You understand? And I don't want you don't have to be sending me any pictures of your vagina or asking deep personal stuff because my social media can read it. My manager can read it. So if you want to be secure, you email me at my personal email address, ddaily@3dgyne.com. Trust me, I get a lot of pictures of vaginas
Really?
in my DM. Yeah, man. It's not safe. Don't DM anybody who is a public figure. Do not DM them your personal information, please. You know, don't do it. Right? Don't do it. Don't do it. Don't do it.
All
So
right.
I'm
Let's
accessible via email.
just repeat. Tina, can you just start the scene again? Just repeat your email. D Daily.
Oh, it's on the page. So go to my page. My email is on the front of the page. ddaily
Okay.
at 3dgyne. So you can just click on my name. All my information is there. It's
Okay.
like an open book.
Okay.
You know, so I put everything there. Even there's a phone number there. That's my nurse number. So you when you get that number, it's actually my personal nurse. You get it, right? So I'm very accessible, very, very, very accessible. I take pride in being accessible.
And just contact Dr. Daly. He'll give you the LiveWithDara discount.
Can work
All right.
something out.
This question now. Do you lose
Labiaplastic, no.
sensation after you do the
Mm. Most sensation is around the clitoris. So I don't trouble the clitoris. So you don't lose any sensation. Remember, don't remember I told you the whole female genital structure is usually relatively no nerves there now compared to other parts of the body. The part of the vagina or the female genital area that has the highest nerve endings is the clitoris. I'm not troubling the clitoris. I stay far from it. So you're not going to have any loss of sensation there.
Janella, you want to do the O shot? Right. This question. So you don't think someone can be happy in a relationship but still find it hard to? Well, okay, that question never finished. Moving right along. Any plans to provide those services in Mobile, Dr. Daly?
That's not for now. It's hard enough for me being between Kingston and Portmore because I work full time for the government as well, you know. I work at the Maypen Hospital, so it's kind of hard. I can't push myself to Mobile yet. You know, something would have to give. But as it is right now, I'm still helping out Maypen. I'm employed by Maypen Hospital, so I'm one of the gynecologists there.
Oh, so you can go to Maypen and start the process right there then.
Well, right now COVID going on, so he can't. Remember, you're not going to get nothing not going on down there in emergency mode. You know, but I mean, I'm the general gynecologist there, so the pregnancy, the clinics, the ward, that's my responsibility. Remember, basic gynecology, no cosmetics down in the public system.
All right.
Fibroids, all those stuff.
All right. Is surgery the best method to get rid of fibroids, or is there medicine or natural remedies?
That's a long topic there, in Chantal. We can't talk about that. I'm actually talking about fibroids right now if you go on the page. A long topic. Everybody is different. So you have to treat the patient differently. Some women need medicine, some women need surgery. Very broad topic. Can't answer that one right now. I'm sorry, but I'm doing my next set of posts actually started fibroids. I think we're going to finish up by the end of this week. And all the questions about fibroids going to be answered right now. So 3 posts are there now on fibroids.
Curious, do we have to make an appointment to see you?
Yeah, man. I do the walk-ins. As I mentioned before, I'm only by appointment. Because again, because of my obligations, I'm not sitting down in office waiting on patients. I have strictly appointment right now. So you definitely have to make an appointment to see me.
Okay, so let me go back to the O shot. Is there anything I need to take into consideration if I'm interested in doing the O shot? Is there something I need to ensure that I'm okay on a particular level?
Well, I have to do a consultation with you and I have to assess you and see what you need. Well, anybody's needs are, and what's the best option for you in terms of what your problem is, what do you really want to achieve. But there's no preparation needed for it. You know, you just come in. I do recommend you come when you're not on your menses. You know, that's
Definitely.
the only recommendation. And it can help with painful sex as well. How could I forget about that?
For real?
Painful sex, it can help with that. Yeah, man. I have this, I'm gonna just send me an email. I have the book that the guy wrote, and I have a lot of information I can send you and you can read it through from the originator, the Dr. Charles Reynolds, and there's a lot of stuff he's doing right now. You know, he has these O-shot oils he's selling, these sensation oils, these sensual oils, he's mixing the oil with CBD. There's a lot of stuff he's doing to enhance the whole O-shot experience. Whole heap of stuff I'm doing, man. So the O-shot and so much more that we're not even touching on right now.
So your sex life don't have to be boring because there is an answer to whatever issue you have.
Definitely.
Wow.
Definitely.
All right, guys, I want to release Dr. Daley because he's actually on a little break and we took him from his family and friends and everything to be here. Let me just check if I see any more questions before I just say, so this question now, what are the implications of chronic yeast?
Need an assessment. You need to see what's causing it so we can treat it properly. A lot of causes.
Is there any disadvantage in getting the O shot?
Only disadvantage if it don't work. But I mean, like I said, you're going to get some, it depends what you want, but most of the time, as I said, most women, 60% of women, if I do the O shot, everybody is saying, yes, lubrication, yes, sensitivity, right? And then we take it from there, you know, but you're going to get something. Something is going, nobody has never told me nothing has happened. So that is why the counseling, again, is very important.
Well, I want to try it. I mean, I think you should live. And I mean, why not try the O shot and live? Eh?
It works. It works. It works.
Yeah.
It works. It works.
Somebody asked you to do some post on
I did a whole set of PCAS. Just go through my page. I did a lot of PCAS last year. There are about 15 slides on PCAS. If you go through my page, there's everything there, you know, really. I mean, it's common things are common in gynecology. You know, we're going to actually be doing a live this week, next week. Me and Dr. Henry, Dr. Jared, Dr. Elliott. I think we're trying to do it one day this week on PCAS. So we're going to do a live. We'll let you guys know. The plan is to do the live. Let me say, the plan is to do the live, depending on how the time stays.
Okay. Somebody's asking in there, is it possible to make a girl squirt on a regular basis?
Anything is possible.
Hi. Alright. Let me see now. Wait, if you. Alright. Sorry, I'm trying to. This question. What if you have a funny smell? You get meds, but it doesn't work. That means the meds not working.
No, I just need to find out what's the cause. You know, let's go to a gynecologist so we can check and see what's going on. A lot of these questions are very broad, and I don't mean to be brushing over them, but these are very long topics that I don't want to start talking on right now because we're not going to stop. O-shot painful. You're frozen. O-shot, no, a little uncomfortable. The most painful part of the O-shot is the clitoral part, but we'll numb it up and we'll do some techniques to prevent it. But the vaginal part, not painful at all. The clitoral part is painful, or can be. But by the time we numb it, you don't feel a thing.
All right, and as it relates to the oku-bit now, and getting it in terms of the rejuvenation, you're saying to ladies, I'm trying to do this with a straight face. If you continue to take things that are huge, you will lose your oku-bit. I'm trying to be
The
doing a
muscles,
diplomatic way.
the most diplomatic way to do it is that the vaginal tone can become more relaxed with the bigger the phallus and the consistency of intercourse. You know, just like a child coming through the vagina. So over a prolonged time, I'm not saying the one time, the two time, prolonged time, yes, it can cause pelvic floor relaxation.
After 17 years, how can you help me to get pregnant? Again, this is a broad one, right? So it needs
Yeah, man, yeah,
consultation.
man. So guys, any non-cosmetic question or query, you can email me or you can make an appointment to see me. We can sit down and we can chat and we can do all of that, but we're trying to stay focused tonight on this topic, right? Because gynecology is broad,
Broad, very
right? So
broad.
anything, just go to my page and email me. Email me. I'm more than willing to answer. Or if we need to talk, I'll tell you to come into the office and talk. Because a lot of times I can't answer everything on email, you know? But I try to see what I can answer. And then most times you need to come in and we talk anyway.
I think you answered this
18
earlier,
months.
18 months. Right.
Yeah.
All right. So that's essentially all the other questions are questions that you need to have a one-on-one with you. Dr. Daley, I want to thank you so much for spending the last 1.5 hours with me. And I'm
It's so
hoping
long.
that, eh? I
It's so
know,
long.
right?
Not even.
And I'm
Oh,
hoping
no,
that
yeah.
my guests, those who were on, would have learned something about getting back that oku-bit or, fixing the appearance of the vagina or getting that O shot because it's important we don't talk about these things, and these are issues that we really should discuss openly to help improve ourselves and our overall
I,
sex life, etc.
yeah, man. I'm big on educating. I love educating women and empowering women. And a lot of this whole topic is taboo and ignorance exists, so I'm just trying to shed some light on the topic and women's options that are available in 2021.
So if you need to get in touch with Dr. Daly for any of the above, just check out his IG page. You see the contact to all his location, and you can just go and visit him at one closest to you. And of
And
course, he
send an
said,
email.
send an
Send an
email.
email. I'm very good at email. I try to answer everything within 2 days, right? Even if it's a one line, I take pride in answering, right? It may take 2 days, but you'll get an answer. And check your junk mail. Everybody said they don't get a reply. Check your junk mail. It's there. It's there.
All right,
You
Dr.
know?
Daly, big up yourself.
Yeah,
You
man.
shall
Thank you for
see
having me.
me. You shall see me while I come do some consultation to get. Oh.
Any, anytime you're ready. Thank you for having me on your platform. I really appreciated it.
Yeah, man, I thank you so much for coming on. Go enjoy yourself now. Enjoy your break because it's a
All right, there.
successful time for you all. All
All
right?
right. Take care. All right.
Take
Bye
care. Bye
bye.
bye. Let me cut out Dr. Daly. So, I hope you learned something tonight. Listen, man. Listen. Go and help yourself. Go give yourself a fighting chance. You see what I'm saying? Go give yourself a chance. Yeah. Dara up to something? No, it's just giving myself a fighting chance. Improving my. Let me tell you something. You ever have a headache yet, or you ever have a bad day yet, and you just need a little to set you straight? Listen, man. Ensure that you sort out yourself so you're alright. You hear me say? So, and get in touch with Dr. Daley. I mean, you can learn a lot. And just visit his IG page because he has a lot of information on it. I know some of the questions that you may have. He has those answers on his IG page. So check him out and then send him, as he said, just send him that email and get the process started. But go and get your oku-bit. Go and go fix it. If you have a problem, go and go start with your oku-bit. If you have a problem with the appearance, and ladies, remember now, at least once vagina, and you go and look and see where going. Make sure she's okay. You know, I mean, the girl call it her purse. Make sure your purse, all right. If you wear clothes, right, and your clothes have on lint, don't you take the lint roll and you take it off and make sure so your clothes look nice and new? Sort out yourself, man. But thank you so much for joining me this week on Live with Dara. I really appreciate you coming on. Next week is a very interesting topic that we're coming up with. Remember now, this is a non-judgmental space, so we're not judging nobody. Next week, I'm actually going to speak with a trans male, a trans female. That's somebody who was born a male, who is now going through the process to change to become a female in terms of everything, the up here, down here, all around here. You know, so just to go through the process and find out what's going on, etc. So for the month of September, we have some interesting lives. I hope you can join me again on Saturday as we continue living with Dara and having fun doing it. Take care of yourself, guys, and I will see you next week. By the way, if you missed it, you can catch it on YouTube. Just go back to my YouTube page. It will be uploaded sometime between tonight and tomorrow morning. So you can catch a live there. Remember, good like and subscribe. Pick up yourself. Until next time. Take care. Bye.